So you are considering opening a new home healthcare business in Washington State? Congratulations. This is a rewarding field. You will be providing a vital service to your community. There are many steps involved in starting a home health agency. This guide will provide a roadmap for your journey. We'll cover everything from legal compliance, startup costs, staffing, and sales and marketing. Starting a home health agency is challenging but also incredibly fulfilling. You'll be making a real difference in the lives of your patients. You'll be giving them the care they need to stay in their homes. This guide will help you navigate the process. It will provide you with the information you need to succeed. Let's get started on this exciting journey. We'll guide you through each step. We'll provide you with the information you need to launch and grow your business. Before you begin serving patients, you need to establish a strong legal and financial foundation for your agency. This involves several key steps. First, you'll need to choose a business structure, such as a partnership, LLC, or corporation. Each structure has different legal and tax implications. It's essential to consult with an attorney and accountant to determine the best option for your specific situation. Next, you'll need to obtain the necessary licenses and permits to operate your home health agency in Washington State. This includes applying for a business license with the Washington Secretary of State. Next, you will need to register your business with the IRS in order to obtain your Federal Employer Identification Number, or FEIN. Don't forget to look into city tax or county tax business license requirements as well. Additionally, you'll need to obtain a National Provider Identifier, or NPI number. This will allow you to bill for any services your agency provides that are covered by commercial or government insurance payers. Other legal considerations will be to remain compliant with the Federal Health Insurance Portability and Accountability Act of 1996, or HIPAA, which protects private patient health information. Also, the U.S. Department of Labor Wage and Hour Division will regulate minimum wage and overtime. Ensure you are following overtime laws currently in effect in your area. These could change each year. Building a dedicated and compassionate team is crucial for providing high-quality in-home healthcare. You'll need to hire qualified healthcare professionals. These professionals may include registered nurses, licensed practical nurses, certified nursing assistants, a salesperson, and potentially, therapists. They will provide direct patient care. You'll also need administrative staff. Administrative staff handle scheduling, billing, and other operational tasks. When hiring, carefully screen candidates. Verify their licenses and credentials. Check references. Look for individuals who are passionate about home health care. They should be committed to providing compassionate, patient-centered care. Once you've assembled your team, provide an agency orientation class, as well as comprehensive annual training. The training should cover your agency's policies and procedures. It should also cover patient care protocols. Regular weekly team meetings are essential for quality assurance. These meetings allow for communication and collaboration. They also provide opportunities for professional and community development. Section 4. Navigating regulations. The Washington State Department of Health. The Washington State Department of Health, or DOH, regulates home health agencies. It's essential to understand and comply with all applicable regulations. Start by visiting the Washington State DOH website. Download the necessary application forms, or you may complete this process online. The application process is detailed. It requires information about your agency's ownership, management, staffing, and services. You'll need to develop a comprehensive Policies and Procedures manual. This manual should outline your agency's operations. It should also cover patient care protocols, infection control measures, medication management, and emergency procedures. The DOH will review your application and supporting documents. They may conduct a site visit to your agency's location. Be prepared to answer their questions and provide any additional documentation they request. The entire process could take up to 6 months based on the state's application backlog and how quickly you provide them with the information they need. Section 5. Operational Excellence. Policies, Procedures, and Compliance. To ensure the smooth operation of your home health agency, you need to establish clear policies and procedures. These guidelines will provide your staff with a roadmap for handling various situations. They will also help ensure compliance with regulations and ethical standards. Your policy and procedures manual should cover a wide range of topics, including patient intake and assessment. This section should outline the process for admitting new patients, conducting initial assessments, and developing care plans. Medication management. Detail how your agency handles medication administration, storage, and disposal, ensuring patient safety and compliance with regulations. Infection control. Describe infection control measures, including hand hygiene, personal protective equipment use, and environmental cleaning to prevent the spread of infections. Emergency preparedness. Outline procedures for handling emergencies, such as natural disasters or local emergencies, power outages, and medical crises, ensuring the safety of both patients and staff. Section 6. Financial prudence, projections, funding, and working capital. Starting a home health agency requires a significant financial investment. It's crucial to have a solid understanding of the costs involved and to secure adequate funding. Develop a comprehensive business plan. This plan should include detailed financial projections. Estimate your startup costs. These costs include office space rental, medical supplies, scheduling and payroll software, website hosting and development, equipment purchases, licensing fees, and other miscellaneous marketing expenses. You'll also need to project your operating expenses. These expenses include, but are not limited to, salaries, rent, utilities, and supplies. It is also required for you to have professional liability and labor and industry insurance as well. Determine how you will fund your agency. Explore options such as small business loans, lines of credit, or investments if you do not have this amount of cash on hand. Having sufficient working capital is essential. Working capital covers your day-to-day operational expenses. It is recommended that you have access to an estimated $60,000 in order to get started. It is helpful to note that if you are considering joining a franchise system, this initial investment amount will be higher. Think of this money as a safety net as you establish operations and hire and train new staff. This will provide a financial cushion as you bring on new clients and build your clientele. Section 7. Strategies for success. Marketing, sales, and growth. Once the state issues your agency license, it's time to focus on marketing and sales to attract patients and grow your business. Develop a comprehensive marketing plan. Identify and understand your target market. This could be seniors, individuals recovering from surgery, or people with chronic illnesses. Also, get to know your competition and how well they are performing. Utilize a variety of marketing channels. These channels include online advertising, social media, print materials, and community outreach. Community networking is the most effective way to grow your patient census. Task your salesperson to conduct 40 meaningful face-to-face visits each week. This employee should also be able to compile a list of 50 target accounts, profile them, and keep your CRM updated. The list of accounts will change regularly based on sales interactions. Focus on your most productive prospects. As an owner, expect to review these sales activities with your salesperson during scheduled meetings to determine progress and/or training opportunities. Build relationships with skilled nursing facilities, assisted and independent living communities, physicians, discharge planners, hospice agencies, geriatric care managers, wealth managers, and trust officers, just to name a few. All of these can potentially send referrals your way. Also, leverage any existing relationships you may have in order to begin acquiring patients. Consider offering free workshops or seminars on home healthcare topics or free clinical training courses. This can raise awareness of your agency and provide possible CEU credits for your skilled staff. It can also position you as a trusted resource in the community. If you have a passion, dedication, and commitment caring for others, then there should be nothing standing in your way of being a successful and valuable business leader in your community.